two-member team of the Union Ministry of Health and Family Welfare to assess the COVID situation in the state of Arunachal Pradesh arrived at the Lilabari airport last night. The team will be submitting their recommendations to strengthen the efforts to control the pandemic. The central two-member team will reach at the Secretary Health anytime soon in the state, and subsequently the team will be visiting the Directorate of Health Services in Naharlagun as well. Well, deliberations on integrated COVID control centers, strengthening of data analysis unit, modes of testing, formulation of guidelines for those undergoing home isolation, strengthening of district hospitals with necessary facilities, ongoing vaccination drive topped the agenda. The team comprises of Professor AIIH and PH Kolkata Dr. Sanjay Sasukhan and Associate Professor of Pulmonary Medicine AIIMS Patna Dr. Somesh Thakur. All right, our correspondent from Arunachal Pradesh, Indu Chukku, is joining us now over the phone line. Well, Indu, we have witnessed Centre on Friday deputed multidisciplinary teams to Arunachal in view of the high number of cases being reported, and today the two-member team have already arrived at the Lilabari airport this morning. All latest updates from your end, Indu.
Yes, Kiana, they have already arrived in the state last night itself, and they have their arrival at the Lilabari airport, the nearest airport here nearby Itanagar in Lakhimpur. It was by 7:30 p.m. and accordingly they have stayed here in Itanagar. And now they are probably meeting the Secretary Health Department and upon hearing Itanagar at their Civil Secretariat office. And accordingly, after that, at 11:30, tentatively they will be moving towards the Queen Capital City here in Naharlagun. And the two-member team will be interacting with all the health officials and the higher authorities of the health department at the Directorate of Health Services. And yes, as the interaction with the Secretary Health Department yesterday, talking to Notice Live, it informed that the two-member team will be coming here. The main purpose of visit is that, some days back, there was a recommendation by the central government to have the visit because as there is a report in the national data that the COVID numbers, the positivity rate is high. But they are saying, the health authorities out here are saying that this is because of some clerical error, and since the numbers of the negative rate has not been put in the slab, that is why. But now after 3 to 4 days, they will be streamlining and they are accordingly getting some health assistance from the district administration, and they are working on it.
Right, Indu. You know, what you're saying is at 11:30, the team will be moving to Naharlagun there. Well, what do you think, Indu? What will be the further course of action to carry out targeted COVID response and management effectively to tackle the pandemic there?
Basically, they have already, the state government has already in order, knowing their arrival, knowing their visit to the state today. Before that, only last Saturday, they had under the chairmanship, under the chairmanship of the state secretary, they have already convened and meeting chief secretary. They have already convened a meeting, and then accordingly they have already pointed out that what they have to do, and they have already deployed some people. Arrangement has been done for the updation. So basically, since they have said that their main agenda is to see the COVID situation, the probable talking agenda will be there when we get what course of action has meted out from the discussion, and they will be telling their situation, their ground situation, and which will be basically about the network connectivity also, because most of the districts here in Arunachal Pradesh, because of network issue and manpower as well, they could not update, and because of this alarming rate has been done. So these kind of grievances and some pointers are expected to be informed to the two-member team who is visiting, who are here in Itanagar.